does a tribal acknowledgement at every one of our meetings. And I'm so happy that David asked that we would do that here as well. Here in Washington, we are in the home of 32 indigenous tribes who have been stewards for this land for generations. In King County, we're on coastal Salish and Duwamish land. In Olympia is on Cowlitz, Nisqually, and Squaxin land. Spokane is in the Tunaxa and the Spokane land. Tacoma is on Coast Salish and Puyallup land. To learn more about tribal nations and where you are, you can text the zip code to 1-907-312-5085. I have dropped a link in the chat, which will give you the link to find out where you are. So I want to wish you all have a good meeting tonight. I'm looking forward to it. And I'll turn it back over to you, Gina.
Thanks, Larry. So now the part of the agenda gets to be me and my very esteemed co-host, MC. I am Gina Owens. I am a Washington CAN C3 board member. I am also on the steering committee of HCHR, which is why I have been put to work here tonight. And I'm going to stop there and let Margaret introduce herself, because she's also going to tell you about the HCHR and what we're about. So Margaret.
Hi, thanks Gina. Hello everyone, good evening. Welcome to our meeting. My name is Margaret Carey and I'm with Working Families Party, Washington State, MLK County. I'm also a member of the steering committee of HCHR and a representative for Seattle Indivisible. I'm going to just speak very briefly. Larry Brown did a great job of sort of setting the foundation of what some of us call HICR or HCHR, is a grassroots community labor effort to secure the fundamental right to healthcare for all people, both in Washington State and the nation. And so we're made up of labor and community groups, and we are working together to create a health system that represents the values we believe in, which include equity, affordability, equitable access regardless of citizen status, and other principles that you'll find on our website. And now back to you, Gina, for, I think we're going to address some of our retreat outcomes of our retreat just a few weeks ago.
For my piece in that, Desired State number 1 was all about the BIPOC communities and the role that HCHR has been and will be more intentional about playing. And we had a great discussion during our retreat about that. So HCHR strengthens community labor character through strong relationships with organizations and leaders in the BIPOC communities. All that is good, and it's going to allow us to go into the communities of color and really build and strengthen the work with those communities. We have been doing some of it already. We want to be more intentional about getting more of that done. And that's going to go hand in hand with some of the racially diverse work we're going to do at the grassroots level. And I'm going to kick it back to Margaret to talk about that desired state.
Yeah, so we had 2 main outcomes, and Gina identified the first one, and the second from the retreat was that we would, again, be intentional and strengthen and engage as a community and labor grassroots movement for equitable healthcare access, centering community voices, particularly communities of color, and engage both in advocacy and direct action. So those are the 2 outcomes. Gina's going to go through the agenda. Before we do that, raise your hand if you were active in the elections this year, 2020. Thank you, everybody, for your action, your activity, and participation. We really made a difference. And as Larry said, there's movement both at the national and state level. Still a lot to do. So Gina's going to go through our agenda for tonight.
So it's very action packed. So I'm just going to go over the highlights. We did the welcoming already, the political context. Larry talked about the land acknowledgement. We're going to be doing some very impressive listening to political priorities. And that's going to help us to determine how we want to vote. And the vote is going to happen later in the agenda. And then after the voting experience, we'll be doing good of the order. And then we'll have a wonderful, wonderful chant at the end of the meeting. And I really hope that you all are listening very well, because I want to tell you now, we are on computer. We're not in person. So you all are going to have to turn your mics on and really chant loud so that I can hear you on my computer when we do the chant. So until we get to that point, does anyone, everyone in agreement with the agenda? Does everyone have anything they'd like to see added? I take it everyone's okay with the agenda. Cool. Now we're at 5:45 and we're on target to introduce political context. Very wonderful. Jim Howe, American Federation of Teachers of Washington, who is the Vice President of Legislative Affairs. Jim?
The area that I was to speak to was post-election context and possibilities. As you see, we're going to start with from the federal side. And with our new administration, we're really hoping that the Biden-Sanders unity platform plays a big role from here on out, especially the section on, and the platform section we're looking at is achieving universal, affordable, quality healthcare. I've listed all of the sections, the subsections of that, but we'll just get into the second one there on securing universal healthcare. I do want to point out before I move on, the co-chairs of this section of the Unity platform are our own Representative Pramila, as well as Vivek Murthy, who is the former Surgeon General and the nominee for the new Surgeon General. So the two quotes that David and I wanted to highlight are these here on page 31 and 32. One is about the public option. As we know, we're not there yet with the Biden administration to full Medicare for all. But if you read this, affordable public option, provide at least one plan with no deductibles, with no co-payments, administered by Medicare. It's pretty much on the way to Medicare for all. And we can argue and debate, implementation of that. The other thing was the statewide healthcare approaches. And in support of this, the nominee for the Health and Human Services Secretary, Xavier Becerra, could play an important role in moving on this and helping the states get to this point. Also on the federal side, I looked and found just last week the Congressional Budget Office, respected, nonpartisan, updated their study that they made in May of 2019. On the subject of affordable health care, and said that a single payer system could ensure every American while reducing overall health spending in the country. So that's a reaffirmation of what we already know. You can read that study, that report on it, to get the range of how much savings that they're expecting. Democrats are still in majority in the House after the election, although a smaller margin. So our work is cut out for us. All the Medicare for All co-sponsors were reelected, which is good news. The Congressional Progressive Caucus has gotten stronger, still led by Pramila, and they will lead with Medicare for All. They've promised to do that. The Healthcare Emergency Guarantee Act, we expect that to be reintroduced right after Medicare for All. Again, I can find lots of numbers, lots of estimates, but this one from just September 2nd was that up to 12 million Americans have lost their employer-sponsored health care during the pandemic. The state-based Universal Health Care Act, we expect that to be reintroduced. And then, of course, the current situation that Georgia election could change control of the Senate. Early voting has started. There's still time to help.
1 minute. 1 minute.
Okay, it says see newsletter for options on how you can do that. Switching to the state side, we'll get into our own priorities very soon. The champions in the House and Senate did well. I've put the most cautiously optimistic statement about the budget revenue right there. And then the state legislative guidelines tell us what our bills should look like. Most important, the Universal Healthcare Work Group recommendations to be delivered to the legislature before the start of the session. And they were polled and asked for individual members to give strong support for their recommendation. I'm glad Larry's here because the Washington State Labor Council resolution unanimously supports both Medicare for All and the Healthcare Emergency Guarantee Act, which is positive movement for labor support, which is sometimes problematic in other states. And here is my own union's legislative agenda, supporting legislation that moves us towards universal health care. Why? Because workers losing their health care just shows the failure of the employer-based system. And here are the references. I believe someone, David, was going to share this in the chat. So the references for all the things that I mentioned. Thank you.
Margaret, you like to?
Yeah, thank you, Gina. I just want to make a brief mention of the tireless work of the Universal Health Care group, the work group, and there are some members who are present of that group. So raise your hand when I call your name, because we have such gratitude for the tireless work you have done. Kelly Powers, Sybil Heppelet, Sherry Weinberg, Ronnie Schur, Lynette Veres, Bevan McLeod, Aaron Katz, and other allies who are on our subcommittee who, as I said, met tirelessly to prepare for the Universal Healthcare meetings. And by the way, also helped to get speakers there to put on record the important testimony of people who are impacted by these terrible healthcare challenges that we have in the system as it stands now. And I think I'm going to pass it on to Pam Dowland for an announcement.
So we're uniquely situated in HCHR to apply pressure at the state and federal level. After we vote on our policies tonight, we are forming a rapid response committee and asking you to please join in to educate and equip our literally thousands of organizational members to bring real pressure. Our legislatures are asking us to be part of a wave of sanity in this time of COVID and inequity. So please indicate in the chat that you will bring your good tools and knowledge to aid this effort. We have all been doing this work individually, so let's get together. Put in the chat your organization and your contact info, and lend us a rep from your organization to help spearhead this effort. So we can call our first meeting and be ready for battle at the start of the session on January 11th. I and fellow NSP members Larry Cole and Kathleen Randall have pledged to organize this effort. So catch the vision and indicate in the chat that you are going to join in. Together we can. We need to work together. Thank you so much.
Thank you, Pam. That sounded really good. Thank you. HCHR membership tiers and voting. We are going to be, I guess, getting some committees going for that. And we have a very wonderful lady here to talk a little bit about that. She's from the Tacoma chapter of National Organization of Women. And we want to welcome Cheryl Wapesha Mays.
Hello, my name is Cheryl Wapesha Mays, and I'm an enrolled member of the Assiniboine Sioux Tribe at Fort Peck Reservation in northeastern Montana. I am an educator of Native youth, and I teach Native sovereignty issues at Chief Leschi schools at the Puyallup tribe. I represent the Tacoma chapter of the National Organization for Women, where I serve as chapter president. I also serve on the Washington State Now Board and the National Now Board, where I have just been elected to my second term. I also serve on the organizing committee of Healthcare is a Human Right. There are two tiers of organizational membership at Healthcare as a Human Right. The first tier is sponsor organizations, which are organizations that make an investment of resources, whether it be financial or time, and who, in addition to attending general meetings, serve on committees or subcommittees. Sponsor organizations have one vote at general meetings and appoint a designated representative to give the vote. The second tier is allied organizations, and those are organizations that sign on in support of the principles of healthcare is a human right. They are invited to general meetings where they have a voice, but not a vote. I signed on to support healthcare as a human right because I felt that it was important to advocate for the rights of not just women, but everyone who needed affordable healthcare. My work on the National Now committees focused on the most marginalized group, LGBTQIA and immigrants. These groups were severely impacted when it came to healthcare. I also have a personal stake in that my youngest grandchild is trans male and is beginning his transition. I need to know that his health care will be fair and equitable. Washington State Now is also being courted to step up and become an ally and hopefully a sponsor. Tacoma Now is a sponsor organization and made a financial contribution last year. After our next board meeting, we will very likely be making another monetary contribution in the near future. As important as our allied organizations are, I would encourage them to also become sponsor organizations because of the important work that still needs to be done. At this time, I am pleased to announce that Children's Alliance has joined us as a sponsor. Please welcome them and their rep, LaTanya Lester, as the newest ally to step up to sponsorship. And finally, if anyone is interested in committee work with policy, organizing, communications, and fundraising, please notify us through the chat. This is work that is very satisfying, especially when the efforts of success can be seen. And thank you for your considerations.
Thank you, Cheryl. We're at the part of the agenda where we're going to be going into talking about the 2021 policy priorities. I want to introduce you to Emily Bryce, Senior Attorney and Policy Advisor for Northwest Health Law Advocates. Emily, are you there?
I'm here. Thanks so much, Gina.
Sure.
So as you know, Fatia has stepped into a new role and Sam is on paid family medical leave. So I'm helping on an interim basis with the policy committee. And I'm glad to outline the policy recommendations of the committee this evening, but of course, welcome comments, additions from those who participated in the process as time allows. I'll kick it off and then turn it over to colleagues. So I don't think I have to say that we approach this legislative session with a high degree of uncertainty about the challenges and opportunities that may lie ahead. On one hand, we have a state budget situation that's fluctuating wildly due to changing circumstances with COVID-19, with the potential remaining, even though the budget is looking better these days, that serious cuts to existing health safety net services could be proposed anytime between the governor's budget, which is expected on Thursday, and March, when the budget committees will start their work in earnest. So that's on one hand. On the other hand, we have a moment of particular clarity and urgency around the need for universal coverage, thanks to the pandemic, a small silver lining, and heightened attention to equity needs. And there are real opportunities, we think, to make progress this year, given the recommendations of the Universal Healthcare Work Group due out at any moment. I don't know if they've come out yet, but I was checking this afternoon. I didn't see it yet. And ideas to build more affordable coverage for those who are left behind now in the existing system, and some serious proposals for progressive revenue on the table. So you'll see that the policy committee is recommending a somewhat flexible policy agenda this year to the membership, together with the three-part framework. First, we developed 4 goals that can set the parameters of our work together. Our thoughts are that we would make progress towards universal coverage on a state and national level, while continuing to make substantial near-term progress to improve affordability and equity, as well as protecting what we have now if budget cuts are proposed. So those are the goals that really are top of mind for us. Turn to the next slide, please. You may be wondering how we expect to get from those broad goals to positions on particular bills and budget priorities. And that leads me to the second part of our framework, which are filtering questions that the group can use to vet particular bills or budget items as they're surfaced. Specifically, the policy committee expects to consider whether any proposal supports our mission of healthcare as a human right, and advances equity, and moves us toward universal coverage, but then also takes a look at the feasibility of the proposal, whether there's a strong mass of support for the proposal and a plan for getting it done this legislative session. With that said, the policy committee has identified some particular proposals or issues that seem likely to meet this framework this session, which I'll discuss on the next slide, please. So there are a few buckets of proposals that the policy committee expects to broadly support this session, with specific priorities within those buckets identified using the filtering criteria that I mentioned as we get further into the process. First, at the top, we need to not slide backwards. So we really want to prioritize preventing cuts to healthcare and other safety net programs. As I mentioned, they say the budget could be balanced now, but that could change with the next forecast. So if we need to do defense work and raise progressive revenue to prevent cuts, the policy committee recommends supporting that. Second, we want to move forward in a real tangible way in our quest for universal coverage, and we expect that there may be a few opportunities to do that this session. I'll take these somewhat out of order based on what's on the slide. So first, we want to move forward on the pathway to universal health coverage, building on the recommendations of the Universal Healthcare Work Group. And folks are working on proposals there that we look forward to reviewing. We also want to take steps to fill in existing known coverage gaps. A couple of those include expanding Medicaid postpartum coverage beyond the current 2 months that people receive to a full year, to ensure that people who have recently experienced a pregnancy are not cut off at the critical moment in their health coverage. We know that this is going to be a really important one to prevent maternal mortality, particularly among communities of color, and got all the way through session last year and then was vetoed at the last minute. So, so that one we expect will come up again. Second, we want to support expanding access to people who do not qualify for coverage today due to their immigration status. There's been an equity campaign that is led by immigrant-focused organizations, El Centro de la Raza, WISN, ACLU, and others to expand coverage for immigrants who do not qualify today for subsidies or other coverage at parity to what they would receive if they were citizens or lawfully present immigrants. So we expect to see proposals coming forward on that topic, and the policy committee recommends supporting. Third, the policy committee suggests expanding the affordability of access to coverage on the exchange. We know that the exchange has recently completed a subsidy study for the Cascade Care program, recommending that state premium and cost-sharing subsidies be made available to improve affordability for those purchasing on exchange, so they don't pay more than 10% of their income on coverage. And anybody who's purchased coverage on the exchange knows how expensive it can be despite the federal supports that exist. So we expect to want to support proposals in that area. Next, we expect to want to support proposals around access to particular services that are often out of reach today. We know that there are real challenges in access for people around dental care and mental health supports, behavioral supports writ large. Some of our next speakers are going to speak to some of those topics. And last but not least, we want to think about expanding access to generic drugs, again, targeting that cost issue, including insulin, which of course is often very costly for people, by supporting proposals around setting up a public manufacturing process in line with a bill that California passed recently that really could maybe make a dent on affordability and in the area of drug access. I'm going to turn it to others to talk about the remaining, and of course we can dive back into any of this during Q&A. But first I will turn it to Sybil Hippolyte, Legislative and Policy Director of the Washington State Labor Council, who's going to talk to us about health system transparency.
Okay, thanks so much, Emily. In this group, we're really focused on expanding coverage to everyone, making sure that everyone has access to care. We focus a lot on what form that'll take. Another really important piece that we should focus on is the cost of delivery. As we all know, the cost of healthcare is rising all the time while the quality is going down, especially as we see increasing mergers and acquisitions happening in the healthcare space, which means that the delivery system is acting more and more like huge conglomerates, more and more like monopolies, where they just don't have to have a ton of accountability to folks. So in order to be able to cover everybody, we need to understand what the costs are, how money is moving in health systems, what organizations are actually part of health systems, because many of them, right now with all the mergers and acquisitions, sometimes we don't even know who all is included. So there's a bill that Representative Macri has been working on for a couple of years now. It's on health system transparency, and some of the things it will achieve is getting more clarity on the revenue and expenses coming in and out of hospitals, as well as understanding a little bit more about community benefit dollars for nonprofit hospitals that have an obligation to provide community benefit, and having more of a racial justice lens there and understanding how they're investing in health for marginalized communities. Another related piece is having more transparency on mergers and acquisitions, and ensuring that as these mergers are happening, that we understand what the impacts are to care and to patients. So those are some of the areas it'll cover.
Thanks so much, Sybil. That's really exciting. I will next turn it over to Latanya Lester, Health Policy Director for the Children's Alliance.
Hi, everyone. Apologies for the background noise. Can everyone hear me? Okay, great. Well, thank you, Emily. I just wanted to speak a little bit about dental care and dental therapy. Dental therapists are a mid-level provider who, for Washington statewide, would be a new member of the dental team. Currently, dental therapists do practice in tribal settings in Washington. And have been working in Alaska for around 16 years, in Minnesota for over 10. And so for Washington State, we know that people aren't getting the access to dental care they need. For people with Apple Health coverage, the numbers for adults are around 23% of adults were able to access a single dental service or more in the past calendar year. For children, that number is about 56%, but that means over 440,000 children not receiving care. And those are just the numbers we know, which are the Medicaid access numbers. We know that lots of people don't have dental insurance or have dental insurance that is not really affordable for them to access care. So we know that accessing dental care is incredibly important. And we also know, thanks to how it's working in Alaska and how it's working in Minnesota and here on tribal lands in Washington, we know that it is working for these communities. And one of the goals of dental therapy is to have people from communities that are both often underrepresented in terms of healthcare professionals and underserved currently, because of systemic racism, making a pathway for people from those communities to become providers. We know that that is one of the best ways to improve health equity, by having trusted community members providing care. So I'm happy to take questions, but I'll try to keep it brief. So I will pass it back to Emily.
Thank you so much, LaTanya. That's great. The last person that I'm going to pass it over to is Riley Watts, the Executive Director of Country Doctor Community Health Centers.
Yeah, I'm happy to represent Community Health Centers tonight. I direct Country Doctor and Carolyn Downs clinics in Central Seattle. Just a reminder that the Community Health Center movement really shows us today what universal access looks like. We have a living example today of what we're trying to strive for globally. There are 27 community health centers in Washington, about 350 care sites, and amazingly, we serve 1.2 million people in Washington state. That's 1 out of every 6 or 7 people in Washington state went to a community health center last year. And just a reminder, we're not-for-profit organizations trusted by our communities. We serve people regardless of language, insurance status, immigration status, no barriers, and governed by our patients. We are accountable, I'm accountable to my patient board. All community health centers have majority patients on their board. Just a little bit about how we provide access to care where the private sector fails. 9 out of 10 of our patients are low income statewide. Over 1/3 of the Latinx and Black populations in Washington state went to a community health center last year. About 40% of the state's Medicaid population, a large number, about 100,000 uninsured, attend community health centers, and many of the unhoused and sheltered residents as well. Just needless to say, our patients and staff are on the front lines of the COVID epidemic, clinically, emotionally, and economically. So this is not a time to take the foot off the gas of the community health center movement. Earlier this week, maybe it was late last week, the Washington Association for Community Health adopted their legislative priorities, which largely align at a top level with what we're going to be voting on tonight as it relates to protecting the safety net and also raising revenue if necessary. We're particularly concerned about possible cuts to the state Medicaid program, and some of these are described. David said he might put a slide in the chat box, but including scary things like eliminating adult dental services or interpreter services, maternity support, and more. So it's for that reason that I am glad to vote yes tonight. Thanks.
Thank you so much. And thank you for illuminating some of those proposed budget cuts that have been discussed, which I glossed over, but are very scary indeed. And I hope that we will not see them. So I will, in light of time, I think, go to the federal policy proposals on the next slide. And I won't take too much time because we got a little bit of information from Jim Howe already, and I don't want to duplicate what he's already discussed, but I'll share briefly. So we have the same commitment to preventing backsliding on that we discussed on a state level, on a federal level. So we don't want to see cuts to existing programs. We want to see strengthening, as we've discussed. We also have some carry forwards from the previous year, including the National Single Payer Bill and the State-Based Universal Healthcare Act. And I won't talk too much about those, since those should be familiar to folks. And then we have 2 bills that were not in the platform that we adopted for 2020. We've already talked about one, the Healthcare Emergency Guarantee Act, which I understand folks voted in May to support this. And it's the only COVID-related proposal that would immediately establish universal coverage until the pandemic is over, empowering Medicare to cover all of the uninsured and cover out-of-pocket expenses for others with existing coverage. And then the other bill that's new on the federal platform is the Make Medications Affordable by preventing pandemic price gouging. This one was recommended by our member, the Washington State Alliance for Retired Americans. And the MAP Act, as they're calling it, would ensure that any taxpayer-funded vaccine or treatment for COVID-19 is accessible, affordable, and available. And it is really geared towards preventing monopolies and licensing issues with the taxpayer-funded drugs that are being used with respect to COVID-19. So wanting to make sure there's some accountability and transparency in that process since taxpayer funds were used to support it. I will see if member David Loud would like to comment on anything on a federal level before we move on.
No, Emily, between you and Jim Howe, I think you did a great job. I'll just point out that almost all of the member organizations of Healthcare as a Human Right signed onto a sign-on letter to Congress regarding the Healthcare Emergency Guarantee Act that Healthcare for All Washington, one of our sponsoring members, initiated. And partly on the strength of that, Congressman Adam Smith, at a town hall meeting I attended, agreed, yes, that's a good short-term proposal. In other words, until the pandemic is over. And he signed on to that bill. So the support we've already given that this year has been significant. And my understanding, as Jim said, is that it's going to be introduced after the Medicare for All bill is reintroduced by Pramila and Senator Sanders. So I don't know if there's any questions about it, but I'm hoping that this Emergency Guarantee Act is pretty familiar to most of us.
Thank you, David. That's very helpful. Well, I think that concludes my segment, so I will turn it back over to Gina or others to talk through the next section.
Margaret, are you ready to do the questions before we go into the vote?
Thanks, Gina.
Sure.
I'm seeing no questions. So unless people quickly put anything in the chat, I think we're ready for the next section here.
Wonderful. That would put us on time too.
Right on.
So the next portion is actually the voting by sponsoring HCHR members. And that is going to be facilitated by Mike Andrew, Executive Director of Puget Sound Advocates for Retirement Action.
Yeah, thank you, Gina. I am the executive director of PASARA, but I'm actually here representing Pride at Work, which is an LGBTQ labor organization affiliated with the AFL-CIO. So I will be voting for them and not for PASARA when we take the vote. So let me just take a minute to explain the process. I'm going to be going down the list of sponsoring organizations. We'll be voting up or down on the whole package of proposals. So when I call your organization, you can vote yes, you can vote no, or you can abstain. Then at the end, we'll tally up the votes and the proposal will pass if it gets a majority of those people present and voting. Present and voting means we look at the yes, we look at the no, we ignore the abstentions because the abstentions aren't voting. So if everybody's ready, we can start. Washington State Labor Council.
Hi, I was just about to unmute myself to ask a question. So the State Labor Council, unfortunately, is unable to vote yes on Cascade Care subsidies based on the source. The source for the revenue will be fees on Taft-Hartley health plans. So at this time, a number of our locals are opposed. So we wouldn't be able to say yes on that. So would we be able to pull that one out and then vote on the rest of the package?
So I know that at least one other person is going to vote yes and abstain on a couple of pieces. So do you want to vote yes and abstain on that, on the taxation piece?
Yes, that sounds great. I will vote yes and abstain on Cascade Care subsidies.
Okay. Thank you. Alliance for a Healthy Washington.
Yes.
Votes yes. AFT Washington.
We vote yes.
AFT votes yes. Asian Counseling and Referral Service.
Yes.
Votes yes. Backbone Campaign.
Yes.
Votes yes. Children's Alliance.
Yes.
Children's Alliance votes yes. Community Health Network of Washington.
Yes.
Votes yes. Country Doctor Community Health Centers.
We'll vote yes.
Yes. Democratic Socialists of America Tacoma Chapter.
Yes.
Votes yes. Doctors for America Washington Chapter.
Yes.
Votes yes. EOI has told us they're not able to send a rep, but just by chance, anybody from Economic Opportunity Institute here? Okay, not present. Faith Action Network. Faith Action Network.
Faith Action Network will vote yes.
Faith Action Network votes yes. Healthcare for All Washington.
Votes yes.
Votes yes. League of Women Voters of Washington.
Yes, we vote yes.
Thank you. Machinist 751 Retirement Club.
Votes yes.
That's yes.
Yes.
Thank you. MLK County Working Families Party.
Yes.
Votes yes. NARAL Pro-Choice Washington.
Yes.
Votes. Did I hear a yes?
Yes.
Okay, thank you. National Organization for Women Tacoma Chapter.
Yes.
Votes yes. North Seattle Progressives.
Definitely yes.
Yes. Northwest Health Law Advocates.
Yes.
Yes. Pacific Islander Health Board of Washington.
Absolutely yes.
Absolutely yes. Puget Sound Advocates for Retirement Action.
Yes, absolutely.
Yes, absolutely. Thank you. Physicians for a National Health Program.
I will vote yes, although I do want to comment that Cascade Care subsidies is barking up the wrong tree.
Okay. I'll record that as a yes, and we've heard your comment. Thank you.
Okay.
Pride at Work votes yes. Retired Public Employees Council of Washington.
Yes. Yes.
Yes. CMAR Community Health Centers told us that they were not going to be able to send a rep, but is anybody here from CMAR Community Health Centers? Okay. Nobody here. Seattle Indivisible.
Yes.
Votes yes. SEIU 1199 Northwest.
Yes.
Votes yes. UAW 4121. UAW 4121.
UAW 4121 votes yes.
Thank you. And Washington CAN.
Yes.
Votes yes. Washington State Alliance for Retired Americans.
It's not done yet.
I am going to do as Sybil did, and that is vote yes. However, we need to abstain on all three of the federal bills under the federal agenda. because we're a state chapter of a national organization that has not endorsed those bills.
Okay, thank you, Jackie. And Whole Washington.
Yes.
Yes. Okay, so let me just count these up for a second. Okay, so that's 30 yes, no votes, and the abstentions that were noted on particular pieces of the legislation that was recommended. 2 sponsoring members not attending. So the proposal passes. And back to, I guess, Gina.
We are at the point now where we're going to do good of the order. Margaret, did you have any good of the orders to?
I do. Thanks, Gina. And I think a couple of people after me. So I wanted to alert everyone that the newsletter from HICR, HCHR newsletter does highlight opportunities to work on the Georgia elections. The election is January 5th, and people are already voting in Georgia. So I put in the chat, Working Families Party phone banks are every Mondays, Tuesdays, Wednesdays, and Thursdays between now and January 5th, the election. Also, there are some text banks. The last one is Saturday. We're moving now to phone banks. And within our newsletter from HICR, you will see other opportunities. So looking forward to, hoping to bring in the wins for Georgia. And I think there's some other folks, maybe Ronnie Shore or Robbie Stern or Samantha Overstreet.
So I just want to announce that there's going to be a webinar on February 2nd, Groundhog Day. The title of it is Disadvantaged: How the Medicare Private Option Fails Us and Sabotages Medicare for All. And the speakers, presenters at that webinar will be Wendell Potter, who's the president of the Center for Healthcare Democracy and Insurance Industry Whistleblower; Diane Archer, who is the founder of Just Care and formerly the founder and president of the Medicare Rights Center; and Mark Dudzik, who's the national coordinator of Labor Campaign for Single Payer Healthcare. And we're very worried that the Medicare for All advocates are not aware of the extent to which the Medicare Advantage program, the private option, can absolutely undermine any campaign to create a Medicare for All system in our country. And these 3 rather prestigious speakers are going to be coming and talking to us, one, about how the Medicare Advantage option is actually failing in terms of the system as a whole, but as importantly, will be able to undercut in a significant way. Somewhere around 36% of all Medicare recipients are now in Medicare Advantage plans. Folks in the Medicare for All movement need to understand what's going on there so that they can be sure that when they're advocating, they understand the challenge that's presented by that Medicare private option. That's February 2nd, and there'll be lots of publicity going out about it.
Thank you, Ron. Samantha Overstreet, are you there? Did you have something to share?
Yeah, I just wanted to update people about what's going on in Tacoma and Pierce County with the health department, because it is literally happening now. They are planning, at least as far as I know, to still vote. If you haven't heard, the county council is attempting to vote to dissolve the partnership between Tacoma and Pierce County, which would effectively dissolve the health department and put it under the control of the county executive. They have not voted on this yet because they are still hearing a lot of very angry public comments, which is good. People are very, very upset about this. but they did pass an amendment earlier in their meeting to essentially attempt to get around the governor blocking their efforts yesterday. So it would allow the county executive to essentially start the process of dissolving the health department as soon as the pandemic emergency has ended. And that amendment passed 4-2, despite the fact that there was discussion of it possibly being a criminal act to even be voting on it because of the governor's proclamation that they're not allowed to do this. I will put a link in the chat to the live meeting if anybody feels like tuning in after this, but this might be a continued fight even after tonight. So we'll see what happens.
Gina, I want to confirm that I did put into the chat two things: the outline of potential cuts to safety net programs that Raleigh Watts talked about, and the outline of political context and possibilities that Jim Howe presented.
Cool.
This is Sherry. I want to comment about the Universal Healthcare Work Group. What we don't know until Friday what happened when they actually polled the members of the work group to see if if there's a majority in favor of anything. It seemed like there is at least a plurality in favor of Model A, which basically would ask the state to work towards having the healthcare authority cover everybody and set up a system to do it without involving private insurance. Within 3 or 4 years, it's recognized that it would take time to set up the bureaucracy and so forth to be able to do that. So the reason I'm mentioning this is it looks like what we're going to need to do is to advocate for getting started on setting up a single payer system, which is not expensive right now because it's just setting up the bureaucracy to do it. But meanwhile, we're going to need to do some little patchwork sorts of things, like, for instance, if they could manage to do it, funding subsidies for Cascade Healthcare. Anyway, there are other kinds of things that would, for instance, cover the undocumented right away. The things that for people who need something right away while we're setting up a single payer system to go into effect in 3 or 4 years. So I wanted you all to be clear about that because it's not a real simple, yay, single payer. And how are we going to pay for it? That will come over some time. There is money in this state. We're spending plenty. We just have to corral it into a single payer system.
So Sherry, this is Bevan McLeod. I'm just going to say really quick, stay tuned because Alliance for Healthy Washington is working on exactly that.
Yes,
so we'll be chatting with everybody in the near future.
Exactly. And my comment about barking up the wrong tree with subsidies for Cascade Healthcare is guess where those subsidies go? They go directly into the pocket of insurance companies.
Does anybody else have any comments or things they want to bring up?
Thank you. It's Pam, and I do have one comment. I thank the people that put their organizations in the chat and left some contact info to get going on the rapid response. We expect to hear from us within the next couple of days. And also I have put my contact information in the chat. So I'm looking forward to a robust rapid response with our organization's power starting to show. Thank you.
I really feel confident about the direction that HCHR is going in for the 2021 year ahead. And that being said, I really want to get to this chat. I mean, not chat, chant. Because I want to hear, I want to hear that I'm not the only one who's excited about the direction we're going in. So like I said in the beginning of the meeting, I want everyone to turn their mics on right now because we're going to do a chant. Margaret is going to help me lead it. And we're going to chant really loud because we want not only me to hear it, but I want all of the lawmakers who aren't on this call to realize that they can hear you chanting, okay? So we're gonna have to be loud because that's what we wanna do for the rest of the year, right? So is everyone ready? Do you have your mics turned on? Okay, just so that you know, the chant is no healthcare, no justice, no justice, no peace.
Okay. No
Are you
health
ready to kick it off?
Yes. No
Let's
health
go.
care.
No justice.
No justice.
No
Justice, no peace.
No
Healthcare, no justice. No justice, no peace.
We need some better coordination here somehow.
Got it. Wonderful, everybody. I'm so happy that everyone turned out tonight. We had a really good crowd. Everyone participated in the vote that were sponsors. We only had two that didn't show up tonight. Nobody said no. That's a good thing, right?
Yeah.
Yes. Yeah. So we're closing out really good. I'm happy about that. And I just want to say again, thank you. Thank you to the group who put this meeting together.
Gina.
David Loud, Nathan, Larry, Kelly, Margaret, all of you guys. Vanetta, did you have something to say real quick?
No, I'm saying thank you. Thanks to you.
And somebody save the chat.
Yes.
Well, I'm ready to, if no one else has anything to add, we're ready to adjourn this meeting. And what do you all say?
Yes.
Yes.
Thank
I
you.
love you all. I hope to see you in the field. Give
Yeah,
everybody
baby.
a round of applause and good night.
Good night.
Good night.
Bye.